A desperate cry today from those in our community living with developmental disabilities. Their needs were front and center at a town hall meeting in Beckwith Township. Lanark, Frontenac, Lennox and Addington MPP Randy Hillier says families are hurt by a lack of Ontario government funding. Ryan Whyte lives with Duchenne muscular dystrophy, and he wonders...
Whyte. I live with my mom and sister, and I have Duchenne's muscular dystrophy. I am here today to voice my concerns with regards to funding that is not available for my care at home. At the present time, I receive ODSP. Also, I am allowed 50 hours a month from the Access Center, where they send in a Red Cross worker. There is $10,000 a year from Special Services at Home, which covers 833 hours a year. There is 8,760 hours in a year. My funding allowance covers 1,433 hours a year, leaving 7,337 hours that are not covered. If I were living in a hospital, for example, it would cost minimum $2,000 a day, $730,000 a year. We have been lucky. My mom works at home in the village where we live. And one of her jobs allows her to work in the evening. My sister and nephew and friends do help out at times, and at times I'm left home alone. I didn't realize how this situation is riding on such thin ice until October 2007. We had an accident at the Ottawa Civic Hospital, which resulted in a broken bone in my mother's leg. When we got home, we were in big trouble. Mom couldn't walk, therefore couldn't help me. We did call the Access Center, and there was a person sent in that evening. She did try to get me ready for the night, but she physically couldn't pull me up and over in the bed. We have discussed this in the past with the Access Center, that the people that they were sending couldn't physically help me. There just isn't people in our area to meet these needs. My sister, even my 74-year-old grandma, finally got me ready for bed. What I am saying, why can't funding be granted to my mom and I so we can pay the people we know can do the care? My mom was offered a postmaster's position at a post office out of our area. She couldn't take the job because there just are not enough hours being allowed for my care. She's staying home with me in order that I can live at home, which is my right to do. But in order to do this, we are living in poverty. This situation has cost my younger sister to give up full-time high school. She needs to work more hours in order to support herself. Yeah.
Thank you very much.
With me living at home, it has saved the government hundreds of thousands of dollars a year. I have had this disease since day one, and I am now 20 years old. I am not asking for something that is not there. If the funding if I was living in a facility that could manage my care, why can't we get a fraction of that same funding for me living at home? My family is around home, my friends drop in, and I have a lifestyle that I enjoy and can cope with this disability. My good health is because of the great care I get, and this family will continue to be together. Being denied funding is not only punishing me for living at home, but my family is suffering also. Okay?
Yep.